I think, yes, we've got our experience, yes, we've got our skills, yes, we've got our intuition, but I think first and foremost, we're always led by the client.
The Massage and Physical Therapist Talk Show, brought to you by Massage Warehouse.
Hi, sorry to interrupt, but just a quick cheesy message just to say, if you're really enjoying this episode, you're enjoying this podcast, please do like, subscribe and share. Subscribing to these podcasts really, really, really helps us as the Massage and Physical Therapist Talk Show book an amazing plethora of guests. If you subscribe, it means that we can plan ahead. We know who's listening. It means that we can attract the best guests and we can make the podcast the best it can possibly be. So thank you for enjoying and keep coming back and listening, and please do keep subscribing, keep sharing, and let's build this amazing community together. Enjoy the rest of the show. So we're back and welcome to episode 18 of the Massage and Physical Therapist Talk Show, with me, your host, Chris Madden from Take a Breather UK, and our very, very special guest today, Nicolle Mitchell from Massage for Dementia. Hi, Nicolle. How's it going?
Hi, Chris. I'm well, thank you. And yourself?
Yes, very well. Yeah. Can't complain. Busy as always, which is always a nice sign. How about yourself? Work good? You keeping busy?
Yeah, the clinic and the community work is ticking along really well at the moment. I would say I've probably struggled a bit more with uptake on my courses the past year or so, and I think that's sort of like an emergent thing coming out of COVID. Still, I think our industry has been really impacted by that, and I've had some interesting chats with other people who are practitioners as well as trainers, and they've been finding it's a bit of a trend as well. So yeah, interesting times.
There is definitely that knock-on effect, which what feels like a lifetime ago with COVID. I mean, pre-COVID, I'm busy with my one-to-one sessions, but I do quite a lot of like corporate visits, for various companies and businesses and stuff, and had a small team of self-employed therapists that would go out and do like massage in the workplace and stuff. And that all stopped from COVID, and I must have had it feels like a lifetime ago, but I must have had a good solid 10 or so regular corporate clients that would be, visits every month or every fortnight. And then they all stopped, and then it took forever with people wanting to go back into the office, and they're trying to persuade people to work, flexi work. So they're trying to get people back into the office where they can. So we've got a few now that are back. So this week we've had three visits in a week from different companies, but that's quite rare actually. Because it's like you say, it's that knock-on effect from COVID. It's just, it doesn't matter what angle it is you do or, that you sort of work from, but there is a knock-on effect there, isn't there?
There is, and I think there's been a real sort of culture shift. Do you know what I mean? I mean, a lot more training is online, obviously. So again, we're all in our bubbles as opposed to sort of like going out and doing the face-to-face stuff. And I don't know about you, Chris, although I find, that there's definitely value in online training. I suppose I just value more that connection that you get with the people that you train with when you attend a course, and I think sometimes, especially when you're working with sort of like more subtle sort of techniques, I think some of that can be missed when you're doing it online. I think it can be done, but yeah, I think there's a real difference, and I think also with the cost of living or greed crisis, whichever perspective you want to take on that, I think people are being really careful with their pennies, and it's more affordable doing it online. So I get it,
It is, but I agree with you. I mean, obviously, there's pros and cons for everyone. So from people doing the course, it might be easier as well, to be able to reach more people doing it online. And I totally get that. But my take is, obviously, it depends what it is, because if it's more of a like a can't get my words out. What am I trying to say? If it's more
physiology
involved, but more of a learning kind of just learning, kind of physiology and anatomy style kind of thing, then I feel like I'd be more inclined to do that online if it's suited, because obviously it's more just like studying kind of thing. But I feel like the physical touch element of a treatment, with no matter what sort of it is that you're learning, I personally, I need to be there in real life, in person, to learn it properly, because it's hard, isn't it, to know if you're doing it right. I think if you're not there actually
Definitely
with the person.
Yeah, I feel the same, and sometimes, you know, it takes for me to, because of what I do is really quite gentle, getting that across to, you know, especially if you've got somebody who maybe comes from a more sporty or deep tissue sort of background or speciality, and you're working with really super gentle techniques, where you're barely even moving the skin. I agree. It people are surprised repeatedly at how they can have such a profound effect with something so gentle. But I just keep saying, if you think you're going gentle enough, you know, go gentler still. And
Yeah.
they're quite surprised about, you know, how light the touch can be and still have such a deeply therapeutic effect.
Well, you need to feel it, don't you, as well? I mean, you need to know what it feels like. Like, I think when you're learning a new modality, for instance, you need to be able to know what it should feel like. For instance, you know, when you're training in massage therapy, for instance, you know, and the tutor comes over and like and grabs your shoulders for a second and just goes like this, and then they do it, and you're like, you then get to feel what it feels like, and you're like, oh wow, right, okay.
Yeah.
You know, there's certain things like that you can't get over online.
Definitely. I mean, I also think that, you know, for some people who might live in the Shetland Isles, for example, it's great because it means they can access training that they haven't been able to access before. So I think, and maybe if somebody's not as able as we are, then again, it can be really helpful for them. So I do. So again, like you say, there are pros and cons.
Yeah.
But I know my personal preference is definitely being in the room.
Well, hopefully, you know, as time goes on, that people will then feel, you know, it's people are still healing, aren't they? And people will gradually start wanting to integrate back into, you know, and be around others again, you know. And it has got much better, hasn't it? I mean, at the end of the day, everyone's happily out in the pub on a Friday night, aren't they? So yeah, do you know, you know, it's just getting that balance of the costs and the travel costs and stuff. But yeah, personally, I in person, get it, you know, get out there and get cracking. But the reason we are here today is we have a nice topic today. Quite a some might find it quite an upsetting topic as well. You know, it's you know, it means a lot to a lot of people, and it's the title of today's session doesn't quite give away what you know. Obviously, I'm going to find out a lot about you, Nicolle, and what it is you actually do. But we're looking today at, are you really listening to your massage therapy clients? That's today's topic, and this is such a broad topic because you know, it's as therapists we need to listen. That's listening is our sort of our main sort of skill, isn't it? You know, and finding out from our clients what they need, you know, and how we can help and maximize the time we have with them. So just tell us, Nicolle, a little bit about yourself, and what it is you actually do.
Okay, so I'm a holistic massage practitioner, and I specialise in treating people who live with dementia. I also train other people how to use therapeutic touch to improve the well-being, and also health outcomes for people who live with dementia. I've got 3 courses now. So I've got the 1-day course, which is more of an introduction to it. So it gives you the basic skills to kind of get cracking with you know, everything that you'll need to massage a person who lives with dementia safely. But I've also got the 2-day advanced course now, which goes in much more deeply. There's more, instead of maybe just working with people with their hands, forearms, faces, we'll do much more body work, and we'll do, rather than just seated massage, we'll look at people, you know, as if they were in their own bed or something, or in a hospice, or a nursing home sort of environment. And also last year, I have now finished developing aromatherapy for persons living with dementia, which was quite fun because I looked into a lot of sort of research that's been done in this area, and I'm thinking, oh gosh, I wish all this was around when I first qualified, but there just seems to be this most amazing growth of evidence with massage, aromatherapy, and complementary therapies anyway. And and I think it just gives our profession credibility. So that's kind of what I do in a nutshell. But I also have my general practice, if you like, and I tend to work in a trauma-informed way. So I tend to take on Bessel van der Kolk's principles of working with the breath, as many of us do, working with movement, touch, and also using that sort of storytelling, that regulating voice to help co-regulate a person and then enable them to start regulating themselves as they work through anything at a pace that suits them.
So it's interesting you say about aromatherapy, because obviously, I'm not, I don't know a lot about dementia. Obviously, I read things in the paper and see things on the news, but it's not a speciality of mine, for instance. But I know for something like aromatherapy with the different smells and the senses, obviously, these are the types of things that I can bring memories back and bring sort of feelings back to remind someone that may be suffering with dementia of a time when they, that smell, for instance, might have reminded them of going for a walk through the forest and so on, so I can see how important and beneficial, essential oils and aromatherapy can be in that sort of environment, but also could be quite a tricky situation as well, because you must have to know what to use and what not, because you don't want to trigger off something that's going to then cause a bad memory or a bad reaction, if you like, of something
Absolutely.
that's bringing back something that they don't want to be thinking about, or confusing someone maybe even further than they may be feeling, for instance. So there must be a lot that goes into that. But before I get to that, actually, what got you into this? So how did you, obviously we all train to be a massage therapist, for instance. We do our level 3, and then from there we all everyone goes off and finds their own kind of path, don't they? I think that's how it works with this sort of field. I mean, I obviously do a lot of massage, but I do a lot of reflexology as well. But my first thing was my massage, and then you kind of just steer off, don't you? It's
you go where your heart feels,
yeah,
like you're doing your favorite work, and you attract the clients, I think, don't you, who are going to respond well to that. I think certainly after you get established, I find.
Yeah, and everyone has their own, without even realizing, I think, their own way of doing it, and that's what makes us all unique, and why there's never a competition, for instance, of who's getting the most work, because everyone's got their own sort of way of doing things, and they've got their own clients that like to come to them because of that specific reason, whatever that reason may be.
I so agree.
So how did you get into it then? What led you to this path that you're now currently on?
Do you mean with regards to treating people who live with dementia and
Yeah,
the training?
so because it's quite a very specialized sort of field, that, and
it's a
it's
bit
very
niche, isn't it?
Yeah, it's it's an exact thing, isn't it? Obviously,
Yeah.
and I'm sure you'll tell me about this, but I'm sure there's lots of things of how beneficial this is for people that are suffering with dementia. But what made you think, right, that's what I want to be doing? That's that. Did you think that when you first started training, were you training because that's what you wanted to do, or did you just fall into that?
No, I got into it initially because I was actually interested in the aromatherapy, and I'd started playing around with some of the oils because I used to work with children who lived in children's homes who'd been through trauma, abuse and neglect and so on. And I found things like mandarin, and I started calling them happy drops, or lavender, or sleepy drops. And of course, I needed to learn more, I felt, because a little knowledge could be dangerous. And so when I moved down to Cornwall, it was a really good pause in my life to go and get trained. And I realised that I had to do the massage first, but actually loved the massage and the touch and flew with it, and then went on and did the aromatherapy. And, and obviously you get all your training as you go along. But with regards to the dementia, that was quite an accident, really. My mum used to work in a nursing home that looked after people who live with dementia, and she asked the matron, I love Nick's massages, so I think the people who live here, some of them could really benefit from it. And the matron or manager, she was known as the matron back then, she was like, yeah, okay, thanks, Sheila, we'll bear it in mind. So Mum went and badgered her again, I believe, and she called me in, and then I started off with a day a week, treating the people who were probably most isolated and had less people visiting, and less connection. And I was given 3 bits of paper on how to approach someone who lived with dementia. And I don't know if you've heard about reality orientation, but it was all about that, which means that you don't meet a person where they're at. You constantly tell them, you're here, it's this day, no matter how that sits with them. Now, I felt really uncomfortable I thought, well, I'm sometimes putting a person into a state of ill-being rather than well-being, and that didn't feel very therapeutic to me. So I started reading around the subject, and as I was reading voraciously around dementia, I thought there just isn't a course. I want to just go on a course to be able to find out more about this. And when you consider that dementia has been the #1 cause of death in the UK since 2012, I think now.
Wow, I didn't know that.
I know. Then I think, well, why isn't there a course available? So I think it was about 2009 I started pulling a course together myself, and it took me almost 2 years to, in between sort of like juggling everything that you do, new family, running a clinic, and I think I was probably doing another job. Oh yes, I was working part-time for Outset as well, who at the time delivered dementia care information sessions. So that was kind of running parallel and was really helpful to inform the course that I started developing. And then so 2011 I started delivering that in Cornwall, and then 2012 I got the Innovation Award through the FHT. And so I've just been tickling it out there across the UK, and obviously here in Cornwall as well, to therapists, carers, professionals in the field of dementia, who want to sort of like learn how to connect through touch and compassionate communication rather than, maybe just verbally.
Yeah.
So that's it in a nutshell, how I ended up in this. And interestingly enough, Mum ended up developing a mild cognitive impairment, and then she had to stop work in her late 50s. And she's been very helpful in guiding me, and giving me personal insights. But now she lives with, late stage on early onset dementia. So
wow.
Yeah, I know. So it's like serendipitous, shall we say, that I can support Mum in that way.
So obviously, how does it work? So if do you go into like a care home, is it?
Sometimes I'll go into care homes, sometimes I'll go into individuals, family homes. Those tend to be where my community clients are. So yeah, sometimes I'll go in and I'll do an odd memory clinic or something, which supports people who live with dementia and their carers, and I might do a little workshop or something with people as well, which is always fun. And give them a few tips.
Obviously, I'm just curious. Like, I'm going to ask you questions that come to my head. Like, probably anyone listening to this is probably thinking, right, if anyone's thinking they'd love to go down this path or this route. So the first thing I'm thinking is, obviously, someone suffering with dementia, you turn up to see them. Do they obviously just not know who you are every time you arrive, or is that ignorant? Is that ignorant for me to think that they just don't remember you? Or
I don't think that's ignorance, not in an awful way. I think until you know, you don't know, do you? And every single person is different. So it might be that they know exactly who I am. Or it might be that that fluctuates, because capacity can fluctuate depending on how the dementia is affecting you in that given moment. And that might be in turn affected by how tired or overwhelmed, or if somebody's sensorily overwhelmed as well, then their capacity can be affected. So it really depends on the individual in that moment. I mean, sometimes I know that people know exactly who I am, but they can't remember my name. They'll just go, oh, oh.
Last time you were here, I felt amazing. Yeah,
Well,
get back here, kind
exactly.
of thing.
So, it goes back to that Maya Angelou quote, doesn't it? People might forget who you are, da, 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 but they'll never forget how you made them feel.
Oh,
So,
so talk me through what happened. So you arrive at a client's house or clinic or a care home or wherever it is to see this person. It's the first time. Okay, let's say it's the first time you've met them. So obviously I'm presuming it's not just a case of they just hop on a massage couch and have a massage from you, is it? It's
No.
that's obviously. So is it more about obviously getting to know them, creating just that element of touch? Is it, might just be massaging the hands, or what does it entail?
Well, it can be quite involved. So if you're asking consent for somebody who does lack capacity, I mean, first and foremost, they're the person that you ask, and you either ask them verbally or non-verbally. And I would say that we do that with our clients anyway. But we do things much more automatically because, there's capacity, and just by a person being in your clinic, they're kind of giving you consent.
Yeah, they've booked in, haven't they? They've come for a specific
Absolutely.
reason, so obviously that's why they're there. They've come for a massage, for instance.
Absolutely.
But
But with someone who maybe lacks capacity, or their capacity is fluctuating, as well as having their consent, obviously, you need to look to all their support network. So that might be, in a nursing home, that might be a nurse that's on duty, it might be the manager, it might be the carers, it might be the family members. If it's, I'm thinking of a lady that I see in the community, it's her daughter who I liaise with. And I always do a check-in with people to see what's going on for a person. Are there any changes in a person's health, their medication, the way they're presenting since I saw them the last? And find out what's going on for them so I can tailor the treatment. And then when once I've gotten all that, then what I tend to do is, it depends on the individual, but sometimes what I'll do is I'll waft some of the oils that I use under the person's nose, and I'll just go, oh, this is copaiba balsam. This is really warming for your sore joints and your sore stiff muscles. And I'm going to put a couple of drops of that in. And then I might say, oh, and this is lemon. Have a smell, and get them to try and inhale it and waft it under. And this is maybe good for arthritis and clearing your head a little bit, and making you feel refreshed. And so I'll start by setting the scene, and how we hold space, where you can hold space sort of like metaphorically or through the senses, and that's part of me sort of saying to the person, this is what's going to happen next, without actually telling them. Although
and then being aware that you're there as well, and
absolutely
using the sense of smell and obviously sight, if they've and things like that, just for them to see that you're there, and it's hopefully a nice thing, then and it's a gentle, nice thing that smells nice, and I presume do you have a set time as well that that you're with each person for, or does?
Well, I people book me out for a session,
Yeah.
and then I place in parameters around what what sort of time I allocate for the treatment, for the prep time, because it usually takes a bit longer to prepare, I would say, because you have to go at the person's pace. And if they're not ready, they're not ready. Just like if someone wasn't ready in my clinic, I wouldn't lay hands on until they were ready. And also, again, about sort of like creating that space. I tend to do things like stroking a face, or I might lean in, because there's one lady, for example, I know I'll go and I'll lean right in and I'll go, "Oh, hi, such and such. It's Nicolle, the massage lady. I'm here to give you your massage." And I'll, just reminding her that I'm here to do something really nurturing. And then I'll say, "Well, I'm just going to quietly, mix your lovely blend of oils together," or I might use the word liniment or balm or something that might make more sense to her. And then what I'll do is again, I'll reintroduce myself again through sort of nurturing touch. And then I'll say, I just wonder if I can hold your hand, and then we'll just slowly go in. If she lets me hold her hand, I'll then start stroking her hand and just go, "Oh, I wonder if I could maybe just hold that a little bit more, and actually lift your hand up now," and see if she offers it to me. And if she doesn't, that's okay. If she's happy with just a hand, stroking hand on the top of her hand, that's fine. But if not, she's not consented. So, and I tend to do a lot of pressure through towels and blankets first, light pressure, and then I'll say what I'm doing. I'll do a very gentle, slow narrative of what I'm doing, so if there is anything that they're understanding verbally, they've got that opportunity as well as the felt opportunity, and I'm paying attention to any signs that somebody might be in distress or uncomfortable.
The Massage and Physical Therapist talk show is brought to you by Massage Warehouse. Run by therapists for therapists, we're committed to solving common issues you might encounter in your massage therapy practice. Here at Massage Warehouse, we understand how important your massage table is to you, and how much you try to keep your table protected. However, accidents can happen. The last thing any therapist wants to see is an unsightly tear, rip, or mark on their table. Not only do these marks look bad, there is a chance that they will grow and cause even more damage to your table. Many therapists think they'll have to replace their entire table. However, we have a solution. Introducing our massage table adhesive repair patches, the simple way to fix tears and prevent further damage to your table. To use the patch, first clean around the area of the tear for any dust or dirt using a dry cloth. Next, peel off the back of the patch. After this, carefully apply the patch over the tear. Finally, smooth around the edges of the repair patch for perfect application. And your table should be repaired and good to go. Our patches come in 3 different colours: black, navy and cream. We have different size repair patches available, and should you have a uniquely shaped tear on your upholstery, we can create a custom size repair patch for you. Check out our website massagewarehouse.co.uk to see the full range. Now back to the show.
Because I guess obviously where this differs to just a conventional sort of, someone books in, they come to see you for a massage. Once they're on that couch and they're lying down, unless obviously, this is my approach, unless they're talking to me and they want to have that conversation, which some do, and I know if it's a new client, some can be, feel uncomfortable in silence and they want to just talk, or they've got something they want to get off the chest, and that's why they're there after, for half the reason, not just for the massage, but just to be able to offload whatever it is that they need to say, what's been going on, or
Absolutely, yeah.
So I normally let them lead. Obviously, if they're talking, that's fine, I'll talk back. If they stop talking, I won't then continue the conversation. I just stop. Yeah. I'm quiet as well. But so then obviously in that scenario, I'm then not talking them through what I'm going to do next, or because obviously they're either half asleep, or they want the peace and quiet, or
Of course.
they know what's, especially if it's a regular client, they know they come every month or they come every fortnight. They know exactly what the routine is, and what's going on. But obviously I'm a reflexologist as well, and I go into a lot of supported living houses to provide reflexology, for people that are, for a multi, there's lots of different reasons why they're in there. It might be brain injuries, a lot are non-verbal. So it's a similar kind of setting in the sense that I've got to get used to them as individuals and work out when, what, by their body language a lot of the time, what they want, and how I can steer it, and when they don't want a session as well.
I
Because
agree, definitely. Because you're going to say, sorry, Chris,
no, I was
because
just going to say, because obviously they can't verbally really tell me that they don't want the session, and sometimes they may sit down, and there's obviously carers in the room and stuff, and they know them a lot more about, they know their mannerisms and know them a lot better than I do, so they can kind of catch something that if I may miss it, um,
absolutely. And I think it's really important that that we rely on, their supporters, that person's supporters, to inform us, because sometimes we might get it wrong. Do you know what I
yeah,
mean? And that's okay, so long as we remain curious and we question it. But it's interesting what you say as well, because even people who do have capacity, I think sometimes they're not very good at verbalizing if they're uncomfortable.
yeah.
So what I tend to find is being really aware of those non-verbal cues really helps with my general practice as well. And I do say to people, if there's anything that you're not comfortable with, let me know. Or sometimes I might check in with you, especially if they're a newer client, or they present something like, that there's a sudden jump or a flinch or something, and you go, oh, that was unexpected. I wonder what's going on for you there. Oh, I don't know, I'm feeling a bit sensitive. And I'm like, well, shall I carry on? But the point is that I'm pausing, I'm being curious. And, this is all part of, for me, developing a trusting relationship where somebody will then hopefully be able to verbalize, feel that they're safe enough to verbalize, what is going on for them. So I think one aspect of my specialism definitely informs my my general practice as well.
Because I think when you're doing a conventional massage, obviously, like for instance, you might not be talking to the client, but if you apply too much pressure, you can tell if the body's tensed, or if it, they might not go, "Ow," or like, if it hurts, but you can tell, can't you, by the body, or you can tell how tense, like, when your client's fully relaxed,
Yeah,
because they're literally just sunk into the massage bed or the massage couch, and just, you can they're completely just at ease, but if you can tell when someone's not, because they're kind of tensed up a little bit, or they're wriggling about a little bit, or
there's
you know
always something, because even if again, working from that sort of trauma informed perspective, there are some people who are great at doing the flop and dissociating and convincing and they will maybe put up with a lot of pain as well, and maybe their survival technique is that they really struggle to verbalize when they're uncomfortable, because actually to survive and get through certain experiences in their life, they become people pleasers, or they've learned to dissociate. So again, like you say, there's always something that will lack congruence. So if you're picking up that they've gone floppy, but they're grimacing, or their breathing's become shallow and rapid, there'll always be something, because it's almost impossible, I think, unless you're a real master of controlling everything in your
master of disguise.
yeah, of your autonomic nervous system. I think that would be like really difficult. But yeah, I think there's always going to be something. And I think this is where the congruence is really important, and being present enough to pick up on the congruence of how someone's presenting, the harmony of their body language, their facial expressions, and their breathing, etc. And I think, you know, also context. So if you understand a bit about their history and their context, then you might think, they're doing that thing again. So I'm just going to check in with them, you know, and make sure that this isn't uncomfortable either for a physical, emotional, or a mental reason, you know.
And do you get given any like notes on the person in regards to that? Like, so don't, you know, like they say like don't use these kind of smells or, you know, in your oils, or don't do because they don't like. Do you get told all that, or do you have to just go with
I
it and
ask
just
it.
see?
I ask as much as possible. It's really about being a detective, and sort of like really going deep into. I mean, I ask for someone who lives with dementia, for example, I will go into a lot more depth about sort of personal likes and dislikes. Smells, like you say, are really important. Anywhere they don't like being touched, and again, that's something I kind of, you know, ask people anyway. So, you know, and I might be able to ask the person and waft a smell, or I might be able to get those. I mean, like there was one lady, she loved holidays in Italy, so I used a lot of neroli, and I also used black pepper a great deal as well, which of course Mediterranean sort of dishes were full of black pepper, because she had terrible circulation problems. So the two together, I used repeatedly because it really helped with her circulation and her general sort of like demeanor. The comfort noises and the facial expressions were just sort of like, you know. So yeah, you have to be a real detective, and you have to do all that legwork beforehand. And I really love it when I get somebody who's really on side and really gets it, and tells me what the family tree is, tells me, you know, what a person's tastes are musically. So, you know, the other week I was massaging to Dire Straits.
Awesome.
Yeah, a bit of money for
Sultans of
nothing, taking
Swing
me
and all
back.
that, yeah.
Yeah, absolutely. And because at first I couldn't figure out what wasn't quite right for him. And I don't know, there was something about the music, and I just thought, I said, I tell you what, let's get rid of this. Let's try something else. And this is it. It's about being curious and a bit playful maybe, and trying different things. And literally I put Sultans of Swing on, and he completely relaxed. His demeanor completely changed. So I'm thinking it was as simple as him wanting a change of music.
I think anyone listening to this, whether they're, you know, just whether they're looking to go down this kind of route of massage for dementia, or if they're just wanting to just be, you know, a conventional massage therapist for, you know, they've got a clinic, a room, whatever, and people just book in and come and see them. It's interesting to just, it's all about just getting to know your client, and it doesn't matter, you know, who the client is or what they've got going on. It's unique to that person. I mean, as you say about music, it just made me laugh then, because I remember my mum used to, because my mum was a massage therapist. She's retired now, and a reflexologist. And I remember she used to have one client. She used to have a treatment room in our house when I was growing up as a kid, and there was one client she had that always had to listen to heavy metal music, like rock music.
Lovely.
And she
Lovely.
used to like pre-warn us beforehand and say, right, don't panic if you hear like a load of heavy rock music and stuff. It's kind of, that's what this client likes listening to. It's dead funny. He used to bring his own CD, I think.
Well, some
Because
people do. They
yeah,
have
because my
their
mum,
own playlist.
makes me feel old, but it wasn't Spotify and stuff like that. It was CDs, you know, like an old little CD
Absolutely.
player with, and she used to have these CDs she'd use, you know, like relaxation music, stuff like that. But then this client had to bring, you know, whatever it was. I don't even know. I can't even think
Metallica
what
or
it was.
something.
Yeah, I think it was Metallica actually. It was Metallica or Meatloaf or something like that. Anyway, it was like rock music anyway. And it's just funny, isn't it, what people like to relax to.
Yeah.
Um, but I have a client that I do reflexology for, and I actually, because I'm a musician, I go around 1 week and do music sessions with her. So I take my guitar, and I've built up a little setup there. Because she's non-verbal, so but she loves music and stuff. So I go 1 week and do music, and I guess it's kind of, I guess, a form of music therapy, I suppose. I'm not trained in music therapy. I'm just a musician, but you know, I've figured out from her mannerisms over the years I've got a playlist now of songs that I know are fail-safe songs that I can put on, and it's such a mishmash of tunes. You know, it's all like popular hits and you know, well, from like the 60s upwards. You know, there might be a Beatles track in there, and this, that, and the other. And it's clearly every time I try and put a new song on to play along and play with, or whether I've got a little djembe drum or I've got my acoustic guitar, or I've got even a little xylophone set up there now as well, because I've found all these little sounds that she likes, and it's been a lot of trial and error because she lets me know if she, even though she's non-verbal, I know when it's the, I call it the death stare she gives me sometimes.
I was going to
And it's
say,
dead
what does she
funny.
do?
I get the stare. I'll put a song on and I'll be like, and she'll give me, there's some when I think you're really gonna like this song. I've like, because I've it's been so long now that I've been going there. I'm like, you know, you will like this song because I know for a fact like the little things that she likes and picks out of certain songs. But if it's new, I'll get the death stare at first because it's not the usual playlist of songs that we go through. But I have to keep
Sure.
adding to it so it doesn't, you know, for my own sanity, let alone for hers. But I get that stare and I have to turn around and I get the stare and I say, come on, give it a try because I know you're going to really like this. Wait till the chorus kicks in and then we'll see if you sing it. If you're not liking it, I'll change it. And, you know, and I talk to her and
Yeah.
explain, and then I'm playing and I'm getting that stare and that sort of, that slight shuffle and noise of like, no, I don't want that. What is this song you're playing to me now? And there's some when straight away I just, right, I'll change it. I just know. But then I get to the chorus and then it's the facial expression,
She gets
like
it.
trying to sing along, trying to, you know, bopping along and stuff. And that just comes from human interaction. And I think at the very start of this chat, we said about the whole post-COVID thing and stuff, and not doing as many things in person anymore and stuff. But this is kind of why we need to be doing more things in person, because we need that human interaction with our clients, with people in general, because you get to know what they like, what they don't like, how to communicate with someone. Everyone's different.
And I think it's
So
like a muscle, isn't it? You know, sort of like when, and I don't know about you, Chris, but I did feel some anxiety about being social again. Do you know what I mean? There was a risk. And obviously that diminishes with time. But the more I've exercised that muscle and reconnected with people, you know, the better I kind of feel. And actually that there was a brilliant I think it was a study that I read a couple of weeks ago. And basically what they said was that if you don't go out, or yeah, if you're everybody feels isolated from time to time, but if you feel profoundly isolated, and what happens is that affects your cognition, and it affects your cognition that day, but also the next day. And then because you're feeling a bit brain foggy, you're feeling less confident about wanting to go out. So then you're compounding this kind of circular sort of behavior, if you like, and thinking like, well, I don't feel like going out. And then you feel more isolated. So your cognition, you know, worsens again. So I think you're absolutely right. I think we are absolutely wired for connection, and you know that is absolutely underpins our well-being. Do you know what I mean? The chemistry that we elicit through, you know, face to face and being in the presence of another person. I think, you know, the oxytocin, the dopamine, the serotonin, the endorphins, all that sort of like wonderful chemistry that goes on that enhances our well-being just by being in the room, and then maybe having some sort of touch. So whether you're sidling alongside the lady that you were just talking about and getting physical with musical instruments, that's going to just set off the most wonderful chemistry explosion in her body. But and then more so, as we know, with, you know, hands-on touch.
well, this is why I like doing what we do, because it's always different. So I think obviously what anyone listening to this can take from this is my kind of summary of no matter who your client is or what they might be going through, you just trust yourself and your intuition that you know, and you get a vibe for what they need, and you will build on that.
Yeah, I
You
think
know,
it's always worth deepening your intuition, because I think yes, we've got our experience, yes, we've got our skills, yes, we've got our intuition, but I think first and foremost, we're always led by the client. And sometimes that means checking in with them explicitly, because I think, sometimes we can intuit incorrectly, and that's okay. Again, we take accountability for that. We can apologize, pause, make it right, repair. That's like, again, relational stuff. If there's a rupture, well, then we repair it. And yeah, and I think it is about, I always say we listen not just with our ears, but with our eyes, our hands, our hearts, and our conscience. And if you're doing that in a very present way, then I think you'll be able to intuit that bit better.
so do you think that regardless to if someone wanted to go down the route of doing massage for people with dementia, even just doing some of the training involved in that kind of thing might actually help be a bit, help how you deal with any client? Do you think, does that kind
Well,
of?
I think so, because I definitely, having worked in this field, I think it's really deepened my understanding, and listening to the clients that I work with as well has really deepened my understanding of kind of how to listen to those non-verbal cues, which is very transferable. And I think kind of understanding people's sort of like the legal stuff about people's human rights and treating people with dignity, and understanding about the Equality Act and so on. There are so many things that, that I cover in my training that I think people ought to know anyway.
Yeah,
And
definitely.
certainly, if you work in the NHS, for example, then part of your mandatory training will be learning about the Mental Capacity Act anyway. Whether you work with people with dementia or not, you'll learn that. And yeah, and I think understanding sort of like the benefits of massaging a person with dementia sort of helps you sell not only maybe a specialist service well, but maybe helps you hone how you sell your service well anyway.
Yeah.
So, and I think it's also gets people thinking about how inclusive they can be in their service.
So how do people get in touch, Nicolle? Is someone's listening to this and they're thinking, I want to get involved in this. I'm really interested. I want to up my CPD skills. I want to kind of do a bit, I want to learn about this. Can they do this with you? Can they train with you?
Of course they can, yeah. So I've got a website, massagefordementia.co.uk. You can see me on a bunch of the socials. So there are varying forms of massage for dementia, but I'm sure if you put massage for dementia into Facebook, Instagram, Blue Sky, you'll
And it's
find
massage
me.
number 4 dementia
It is
on Instagram.
It is, I think. Yes.
Been sto-
Thank
I've
you.
been stalking you.
Thank you, because I forget all the different tags and all the different socials. So yeah, brilliant. Thank
So
you.
the website is massage for FOR
Yeah,
dementia, but your Instagram is massage number 4 dementia, just
yeah,
for anyone listening in.
yeah. That's right. Thank you.
And if someone wants to book on one of these courses, for instance, what does it entail? So just if can you kind of summarize like
Yeah.
what to expect? Is
Okay,
it?
so the 1 day course is a bit more whistle stoppy, because the feedback I've gotten over the years is, oh, we need 2 days to do this. So now I do the advanced 2 day course. But if somebody just thinks, I just want the crux of everything to get going, then we learn about, what is dementia. We learn about some of the different types of dementia and how that might affect a person's presentation. We learn about the brain and how that affects different aspects of a person's behaviour. We also touch very briefly on sort of like different forms of behaviour that people might present with, and sort of like why it's important to be a bit of a detective. We talk about the benefits specifically. We talk about the legal stuff. We talk about verbal and non-verbal consent and traversing that, because that's a sticky, and every situation is different. So we might consider some of that. Obviously, we'll look at specialist massage techniques so that people can weave that into their own style, their own repertoire, to offer a dementia-friendly massage in a way that suits their own style. So I don't sort of teach a set routine. It's about weaving it in and making it your own, really.
And they do all that in one day.
I know it's quite.
It's
I
a
have
lot,
to push
yeah.
quite hard
Yeah,
to
yeah,
sort of
yeah.
like
So,
stay
so it's
on
a lot
track.
to learn. Is
There
this in person then, or is this sort of stuff?
It's all in person at the moment.
So they'd come to you in Cornwall, is it?
In Cornwall, but I've also got dates booked for 2025, and I'll be offering group training sessions in London, Birmingham, and Bristol, I think, as well as in Cornwall.
Oh, brilliant! So there's options for people if they're not exactly right where you are. So that's really interesting. So there's the 1 day, there's a 2 day.
There's a 2-day advanced that'll only be available in Cornwall.
Yeah.
And then there's the 1-day aromatherapy, which I'm running in Cornwall and Bristol.
Okay.
Yeah.
Awesome. Nicolle, it's been lovely to speak to you. We could chat to you for hours and hours about all of this, but it was great to just get a bit of an insight into what you do and how you approach kind of, you know, the tricky world of navigating what's right, what feels right, what's not right, what someone likes, what someone doesn't. And I guess, you know, you've got to do it from sometimes for people that don't know themselves, if they might not be able to verbally tell you, you know, you've just got to learn, haven't you? And you know, figure it out. So
Absolutely.
I'm hoping this has give confidence to a lot of people listening.
I hope so.
You know, and hopefully we've given them some wise words of wisdom. But if anyone's got any questions for Nicolle or experiencing any kind of, I don't know, you know, stuff to do with this that they want to just ask you, they can hit you up on Instagram and stuff like that, or go on your website and ping you an email.
Yeah, they can. And something that I'm just about to launch as well is I'm going to launch Your Empower Hour. So whether you're a therapist or whether you're a carer or a professional in the field, just anybody who is maybe having some challenges or just wants to dig a bit deeper, maybe around consent, or they've got a particular case study or something that they want to maybe just sort of like bounce off of someone, then they can book in for some one-to-one.
Oh, awesome. I'm
Yeah.
sure that'll be very popular because we all need a bit of guidance now and again.
Well, it's so isolating sometimes as a freelancer.
Yeah, of course it is,
and I
because you
think
work
it's
on your own,
great.
don't you? So
Yeah, absolutely. So I know that, you know, I've benefited from, you know, being able to call on mentors and colleagues in the field and get some guidance when I've needed it. And it's just nice to be able to offer that as well.
I think that's why I enjoy doing these podcasts so much, because obviously, like you say, it's quite a solitary job a lot of the time. Although you're working with so many different people as clients, you don't really have any colleagues a lot, you know, to bounce ideas off and to learn from a lot of the time. So I think obviously post-COVID, when the Massage Warehouse sort of set up the Facebook group and it brought massage therapists and physical touch therapists together, it created this community that wasn't probably there beforehand. So yeah, so as a selfishly as the podcast host, it's brilliant for me because I'm getting to actually chat and learn from all you amazing people as well. So so what I would say, anyone listening, is do please like and subscribe, just so we can bring and reach more guests like Nicolle and people that, you know, that have a fascinating story to tell, and we can keep these going well through 2025 and then into 2026 and beyond. So yeah, it's been amazing to chat to you, Nicolle, and I wish you the best for the whatever you're up to today.
Lovely, you too. And yeah, it's been lovely having a chat with you, Chris. Thank you.
Oh, thanks. We'll speak soon.
Gerard.
The Massage and Physical Therapist Talk Show. We discuss the talking points that matter to you, the therapist. A lot of work goes into creating the talk shows, and we'd be very grateful if you can choose Massage Warehouse when shopping for massage supplies so we can continue to create these amazing podcasts. Massage Warehouse is your one-stop shop for massage supplies and does great work supporting our wonderful community. Until next time,